And action! Hey everyone, it's DrRic. This is a continuation on treatment plans for headache. Not necessarily with exercise, but headache. Mon had a question about what to do when you have headache and exercise. I thought I would also include what I would treat with as far as rescue. So if this is the first time you're finding me though, don't forget to hit the subscribe button so that you can, and the alert button, and thumbs up if you like the video. Just you can follow me on YouTube as I put out other videos. So headaches, what do we do with headaches? There's actually so many different forms of headaches. See my video and I'll put a link down below. But if you've been worked up and if you're safe, then treatments of plan or treatments of choice would be, number one, if it's severe. I don't have a problem with using medicines, but I can't use Advil. I would say Advil's a great anti-inflammatory, but persistent and repetitive use can cause problems with ulcers. I'd rather have you go with Tylenol. Tylenol is a painkiller, Advil is a painkiller and an anti-inflammatory. Tylenol has less side effects. Whichever you choose. If you're continuing to take medicines on a regular basis, like 500 milligrams 3 times a day, or up to 4 Advils 3 times a day, watch your stomach as far as side effects to gastritis, because it causes that. If it works, great. If it doesn't work, again, you got to see your doc. The cool thing about Western medicine is that we have rescues. We have prescription options, and there are some mighty strong medicines. Ultram, which is a narcotic, you can actually get it by itself in the form of tramadol or with acetaminophen, Tylenol. So it's a narcotic, very lightweight, but when you combine it with Tylenol, it works a little better. Some people just like the tramadol alone, but it's a painkiller. It has some typical narcotic problems like addiction and or constipation, sometimes dulled brain and or sleepiness. So be careful if you're a forklift driver, if you have to drive long distance, if you're using power tools, but it will rescue you if it's needed. And the other thing is coffee. Coffee and its contents, caffeine, can be used to reverse a headache just because caffeine seems to cause a little bit of vasoconstriction to blood vessels. As you watched in my last video, if you have a dilation, you can have a headache with the blood vessels. Constriction can decrease headaches. The problem is you're going down a slippery slope in that you can have caffeine addiction, you can have headaches from the caffeine use in the long run. You can also have GERD or reflux. Check out my video on reflux. The same reason I told you to avoid or be careful with the Advils. I'll put a link down below. Other natural remedies, fast action. There is, those of you who have the option for medical marijuana, I think this topical marijuana with menthol, the evaporative effects of menthol and the CBD and possibly the THC can help with decreasing inflammation quickly, especially if you put it over, if it is muscular. If it's vascular, you might not get relief. Sometimes distraction will help the headache decrease in its intensity. A magnesium spray, also pretty cool if you're low on magnesium. The only problem with magnesium spray by the Life Flow is that if you get this in your eyes, it's kind of irritating. So be careful, but you can use it to your neck and your temples. Wash your hands afterward. If it is an issue that's related to the nose, sometimes antihistamine or nasal crom over the counter can help with allergy-induced nasal congestion. That can cause headache too. Referred pain from a sinus issue. Opens you up, takes care of allergies, and also decreases headache caused by sinus infection. If you have persistence and you think it's your sinuses, you might want to get your teeth checked with your dentist. I love Panaway. This got me through 2 marathons and a couple of ascents up some high altitude. Panaway is a great anti-inflammatory. The active ingredient, this is Young Living, a little pricey, but the active ingredient is helichrysum. I like the way they blend this with the wintergreen. Again, an evaporative. Natural tendency is most people will not even think about it, but this is to represent ice or cryotherapy. I used to use this when I was in USA Boxing to take care of the fighters when they had swelling. If you freeze this, great relief. You can also use it to the back, but just use an ice pack. Ice packs, 10 to 15 minutes, 3 times a day or every hour if you wanted to, not a big deal. The only downside is you can actually get frostbite to your skin, so be careful where you place it. The more a little slower onset. Magnesium, if you're magnesium deficient, might be a good option. If you're not magnesium deficient, just taking magnesium, as long as you don't have any problems with your kidneys, should be okay. Magnesium also has a way to control the way the muscles constrict or work. It relaxes muscles, so if there's a problem with muscular caused headache, this will hopefully help relax you, just like the magnesium spray I told you about. A little slower though, and you have to absorb it. Tramil is a homeopathic topical, and I'm almost out. I used to use this with gua shan or a Chinese skin scraping, and that's the other option. I'll talk about that in a second. Anti-inflammatory, homeopathic, works okay. I use it more for when I skin scrape, if I do acupuncture or Chinese skin scraping. It helps with the bleeding afterward, the black and blue. The other things you can also try orally, are butterbur. Usually if you have a sinus or allergy related issue with headaches, butterbur is great. 75 milligrams twice a day. It usually takes about a couple days to work, but if you're in allergy season and you're getting headaches, it might help you. Also helps open up the nose. The only thing is you have to make sure it has to say PA free. If it's not PA free, it could have an additive in it you don't want. B2, vitamin B2, when it's lacking, if you fix it 400 milligrams twice a day, it also helps with chronic headaches. Now, again, we're talking about more of a slow and steady approach to squashing the headache. And then some people like feverfew, plus minus, I'm not sure. I've had kind of mixed results with people using it. And there's homeopathics. Homeopathic pellets, it really depends on your other symptoms. And if you're going to be using homeopathics, you really have to be under the guidance of a homeopathic practitioner. So look for one. If you don't want to do any of this stuff, then you can certainly do that. I wouldn't go past 30C. And then, as I mentioned before, Chinese medicine, acupuncture would be great. I love using needles to take care of headaches. Sometimes the headache in the face or back of the scalp, you can actually put needles in the arm to take care of that. It's Chinese medicine. I'll probably have to do another video on acupuncture to let you know how it works. But I think it works fantastic. I used to use that on planes because I couldn't take my TENS unit. This is a TENS unit. Couldn't take my TENS unit on a plane. So before, when I would have issues with headaches when traveling, I just put a couple needles in. And usually these things won't trigger the alarm when you go through TSA scanning. So these are the size of these things. I know some people are needle phobic, but again, you can hardly feel these things. It's not like a hypodermic needle or a bloodletting needle. These are very tiny, hardly feel the entrance, shouldn't cause any pain. This is a TENS unit. Check out my video on TENS. I'll put a tutorial link down below. I think that using electricity will help with decreasing muscle spasm, whether it's from referred pain, from a neck pinch, or muscle spasm, or even deep vascular. I think this is fantastic for distracting and relieving headaches. I also have, as I mentioned in the video that I did prior to this, I have chiropractic care. I think it works well if your headache is because of a C2, C3, or C4, any of the cervical spine issues. If you have a problem, sometimes chiropractic can help. You have to be careful. My doctor, Dr. Getz, is really good. You just have to be careful about who you see. Some chiropractors, especially when they manipulate older necks, can cause problems. If it's not a referred problem from the neck, then obviously massage therapy. Coach Carolina is excellent with her massage, and that can also alleviate headaches very quickly. So that, in a nutshell, is it. I usually will also say, do no further harm. So the reason I put this up is because when you have a headache, as I mentioned in the previous video, it can be chemically induced. This causes headaches. Why? Well, if you read the label, I'm not sure if you will be able to see this. I yellowed something called yeast extract. Hopefully you can see that. If not, yeast extract is a nice way that this company disguises MSG. MSG is used to preserve food, and there's some benefits to MSG, but it usually will trigger migraines with a lot of MSG sensitive patients. Chinese food had a lot of MSG, but if If you're headache sensitive, you might want to, when you go out to eat, ask for MSG free food. But that can actually cause a headache. So if you're not sure why you're getting headaches, it could be that. And your supplement maybe has a caffeine product in it or something that you're allergic to. Foods can sometimes cause allergy issues and result in a headache. So that's for a later date. But so Mon, hopefully this helps you guide to where and how you can alleviate these headaches if you get them. Other people that are watching, please put your comments below as far as how you rescue. I appreciate you watching and subscribing, and I'll see you in the next clinic.